So, ladies and gentlemen, I'm honored to have with me an old friend, Dr. Ali Rezai. I don't even know where to start. I mean, he is now the Associate Dean of Neuroscience at WVU, West Virginia University, Executive Chair and Director of the West Virginia University Rockefeller Neuroscience Institute. Since its inception in 2018, he's developed a Rockefeller Neuroscience Institute and a world-class patent care education. Look, the guy is unbelievable what he has done. He's been featured. I was so proud. I was home one Sunday and I'm turning on 60 Minutes and they do two segments with Ali Rezai. No one survives 60 Minutes. I'm going to get him a shirt that says, I survived 60 Minutes. And he was talking about all of his work. He was at the Cleveland Clinic. I met him when he was at Ohio State. He was actually recommended to me by John Glenn, Senator Glenn, because of his work in whole nervous system issues. And then he went down to West Virginia, and because we both had a mutual friend who was a great leader there, Dr. Gordon Gee, and then he was able to take over this Rockefeller Institute, and he's just unbelievable. So, Ali, could we start with your initial work in Parkinson's, but then it has sprouted into so many different things. And would you look, and I want the people who watch this, which will be many, to understand the excitement of what a person like Ali Rezai is doing. He's really changing the world because he's changing our lives. And he would say he's not alone. He's in a team of people, but he is a special man, and I appreciate him taking the time. Why don't we start? Why don't we go ahead and start with where you started and where I first met you with Parkinson's?
Thank you, Governor. I appreciate you very much, and it's been an honor to have known you for so many years since when you were the governor in Ohio, and you facilitated technology development, commercialization, and innovation. So you were a pioneer. So we deeply appreciated your leadership and continuous leadership for our country. So thank you for that. And I'm very excited about the opportunities. The world is being impacted more and more by neurological and mental health conditions. We have 3 billion people worldwide and more than 190 million people in the United States impacted by neurological and behavioral conditions, mental health conditions, and it's getting worse, more and more patients. And we need to find better solutions.
Can I stop you there, Doctor? Is it that things are getting worse, or that we are discovering these things and bringing them out of the closet into the open sunlight?
Yes, I think it's a combination. We're exposed to many environmental factors that we may not know. Also, the world's population, especially in Western countries, we're living longer. So people are living into the 80s and 90s. So the old, when we say you're 70 now, it's like the old 50. If you say you're 90, it can be the old 70. So
is that true?
It is. People are learning. What happens, Governor, is people are controlling their blood pressure, their cholesterol, going statins, heart disease is much better controlled, or even great that we can say we can be cancer survivors now. So people are living longer because of better overall health. And as you age more, you'll have more manifestations of neurological conditions like Parkinson's or Alzheimer's and dementias and other conditions. So it's a function of an aging population. It's a function of environmental exposure, and it's a function of multiple genetics altogether. But Parkinson's is on the rise, especially in rural communities. There's some elements associated with pesticides or well water. And Alzheimer's is on a significant rise, as well as other neurodegenerative conditions. So it's really important that we can find solutions that are based in science. And it's an exciting time across the world that in neuroscience, we're learning things like we never did. And you mentioned Senator Glenn. I used to go on walks with him in Columbus, and he used to say that, Ali, what's in between our ears is one of the biggest frontiers for discovery that needs to happen, like space. And so the brain, we don't know much about it. You have in your brain 100 billion neurons that make you who you are, your personality, behavior, who you are. But we don't know much about the brain as much as we know about the heart and other organs. So it's really a great time that we're learning much more about the brain, and we can impact and help so many people who want to live life to the fullest and live life to the old age, 90s and beyond. So You want to be able to tackle these neurological conditions like Alzheimer's and Parkinson's with science. And the other thing, Governor, I know you're a faith-based person. I think the faith and healing is really important as well. If you have more faith in terms of how you can impact your disease, I think that's really also very important to happen. I think that's an area that is really underscored. It needs to be further scored, rather. So people have social isolation and loneliness that can shorten lifespan by up to 15 years. So meaningful social connections, of having faith in spirituality, the sense of purpose, can really help a recovery and a balance as life comes at you in so many ways. So the caregivers and patients rely so much on faith and spirituality as part of the recovery. So it's not just science, it's science plus faith and a sense of purpose that I think can really help someone regain control and balance and also be therapeutic. So those are important elements, Governor.
Let me ask you, Ali, this question, because it's very interesting. When we talk about faith-based institutions, I wrote the book called Heaven Help Us. Let me ask you this question. What if all of the religious institutions, the mosques, the synagogues, and the churches, made an effort to make sure that people were not lonely, that somebody visited them? My wife had a thing where she used to visit her olds. Is that a really worthwhile mission? Can that save lives?
100.
Or advance lives, maybe?
And it can make lives better. So studies have shown that social isolation and loneliness can shorten lifespan. You can get depression, you can get heart disease, brain disease. If you have somebody who has Alzheimer's, for example, if you just have social interactions, meaningful social interactions, a sense of purpose and feeling that you're not alone, that can actually slow down the progression of Alzheimer's and dementia. So 100% social isolation and loneliness can impact disease and can impact your treatments. So by having your faith and spirituality being an important part of your life, that can really facilitate recovery.
We're going to take to my staff that's here, we're going to take a clip of what Ali Rezai said about loneliness, isolation, and we want to take that clip and we want to be able to put that on YouTube and a lot of different places. We need to get this word out. Ali, you went from Parkinson's to the deep brain modulation. Now you're talking about addiction. You're talking about, give us the breadth of everything that you are currently working on.
Yes, and it's an exciting time, really. Parkinson's, we're now learning much more. So we have a number of therapies that can help people with Parkinson's. I think, Governor, the key thing is to diagnose and detect a condition earlier. When it comes to Alzheimer's or Parkinson's, it's exciting times because no longer when you're diagnosed with Alzheimer's or pre-Alzheimer's, you can say, is it like a death sentence for the brain? There's so much that can be done. So we need to accelerate the science of discovery for detection of the disease, whether it's Alzheimer's and Parkinson's. And to be able to detect it earlier is really important, using a combination of imaging, brain imaging, blood tests, and other means that we have at our disposal. So the excitement is that more than ever, we can help detect these conditions earlier and stay ahead of it. So it's a race, so you want to be ahead in the race against Alzheimer's, and that's really important. So I'm quite excited about the opportunities right now based on biomarkers, blood tests, imaging, and many other elements that are really making our sophistication much more precise for detecting Alzheimer's and Parkinson's decades earlier. And I think it's important that people to understand, by the time you have the first manifestation of Parkinson's with a little twitch in your finger or slowness of movements, or Alzheimer's with recurrent memory problems, your brain has been degenerating for a decade or longer. And that's important. So you have a window of 10 years. Imagine if you can detect something now. If anybody, your audience, knew that potentially, God forbid, 10 years from now, they'll be at risk or higher risk for getting Alzheimer's and Parkinson's, they would change their lifestyles. They would participate maybe in more clinical trials. And Governor, one very important thing is that it's called lifestyle medicine. Basic things that we can all do. Besides spirituality and faith, having stress management. So these have been proven scientifically to slow the progression of neurological conditions like Alzheimer's, or even maybe prevent them if you practice them as a routine part and consistent part of your health and wellness. Just like we practice heart health, all of us, you need to practice brain health. And it's very simple things that we can all practice as part of our daily lives. Stress management is number one. Reduce your stress and anxiety. And maybe if you have depression, you may need treatments because they can accelerate brain aging. Exercise, aerobic exercise, very important to help facilitate the functioning of the brain and the nervous system. Nutrition, a balanced diet, not overly excessive in one diet, but typically a Mediterranean diet has been shown to be great for brain health. Avoid risky behaviors. Reduction in alcohol, very important. Not smoking, very important because they definitively damage the brain and make recovery and resilience and longevity worse. Other areas, sleep hygiene. Sleep is one of the most important things you can do in your life to restore your brain. So every night when you sleep, your blood-brain barrier opens naturally and clears the brain of all the toxins that are accumulated throughout the day because life comes at you in so many different ways. So your body is naturally built to clear all these toxins and metabolize by opening the blood-brain barrier. Now imagine if you're not sleeping well or you don't go to deep sleep, you don't have this natural restorative mechanism. So simple things, sleep improvements, what you put inside your body.
Let's talk about stress for a second, Ali. I mean, you have stress. Everybody has stress, right? I mean, what do we mean by stress?
Stress means the accumulation of how life comes at you. Stress has to do with family issues that we all have to deal with, personal health issues, job insecurity or job issues, food, having financial, so all the things that we all want for our families to live life better. So really stress comes when you have financial problems. You worry about the future for your kids or your family. You have a disease like a chronic disease or God forbid cancer or Alzheimer's. That can dramatically change somebody's life. And Governor, the other thing is that when it comes to disease, we have to also look at the care providers, the caretakers, the family members, because
they have stress.
They have enormous stress, and often the burden is much higher for the person taking care of the.
All right, let's talk about stress for a second. I hate to interrupt you, but I got to talk about stress because one of the reasons why, Ali, that faith is so important, and I happen to believe that faith is a gift. I mean, you can't run around the track and say, I want more faith. Faith is something that God sends to you. And a lot of times people don't hear the call. God sends a message, but they're like so fast or so busy or so negative or whatever that they don't hear the call. If they hear the call, then I think what stress does, and I think this is true with the Abrahamic religions in particular. I don't know enough about the others.
Yes.
But there is a sense there that there is a greater power than you that's looking after you and taking care of you. And you begin to realize that life will go on in the afterlife, that this is not it. So it gives you a sense of comfort by knowing somebody loves you and cares about you who's powerful. And I think, secondly, can put you in a position of where you take things as they come and a little bit differently.
Yes.
That's at least what I find. And it's a really good argument for having faith, or at least opening your mind to it. What about meditation? I have done meditation in the past. Headspace is one that I've used. What do you think about taking 10 minutes, a day or a couple times a day just to kind of meditate? What do you think of that?
I think that's excellent. I mean, prayer is a form of meditation, so prayer is very important. So
right.
We talk about, I think anything to relax and calm and focus you and center you, and taking deep breaths is very important. That slows your heart rate. So meditation can impact your internal homeostasis mechanism. We call it the autonomic nervous system. So when you're meditating, when you're praying and other things, it sort of rebalances you. So we have to look at everything, all these collectively. And I think you're correct, Governor, about the higher sense of purpose from religion that comes and faith. So that really says that it's something beyond your day-to-day stress. Don't worry about today. Tomorrow is here. So basically, there's a future that has a higher order. And if you understand that, I think that gives you a sense of calm about things coming together. So that's really important. So from my point of view, meditation, prayer, all those things are really important. And faith and community are very powerful forces of recovery. And when we combine that with therapies that stabilize the brain, that's when we can see great changes and strides. So
let me just talk a little bit about alcohol, because everybody has this dry January, and
Yeah.
it lasts for about a week and then it's done. But I was never a big drinker, a glass of wine, maybe too often, but not a lot of wine. And since I have stopped all alcohol, I've noticed it's improved my GI system. I know that it's actually put me in a better mood. I mean, there's talk about alcohol, and if you were to have alcohol, how often could you have it? What I'm finding is it pretty common with better GI, better attitude. I mean, talk a little bit about that.
Yes, Governor. I mean, alcohol is a central nervous system depressant. It's like a medication, so it slows down the brain activity and it can affect mood, behavior, and coordination. So, alcohol, it's fine to drink, but only small amounts and in basically significant moderation. So, reducing alcohol is a significant benefit for your brain. And alcohol can make you also ultimately depressed, is a depressant for the human brain. And so, it is not good. If you take it once in a while, it's fine, but it should be in extreme moderation. So, and also, Governor, that may be a segue to addiction. So, alcohol, drug addiction. Our society, people want to cope with stresses and other elements coming at them. So many go into smoking, drugs, alcohol, and all these. And you asked about addiction. Addiction is now an emerging science. So addiction is a big problem in our country. So you have people that are impacted by the curse of opioid addiction, methamphetamine, benzo, alcohol. There's also food addiction, Governor. There's also gambling addiction that is coming very rapidly, especially in the younger generation. And these are different parts of the brain. And there's a nervous system underpinning. There's a part of the brain multiple parts that are involved in what we call the reward center, that with continuous use of alcohol or drugs, especially if you have susceptibility from genetically or environmentally, or if you have a situation where you have a lot of stress. And if you take it when you're younger, where the brain is super sensitive in teenage years and younger, the brain changes and your brain shifts into a new frame of super sensitivity where you always want to take the drugs and alcohol. So we think that there's a new age coming for the treatment of different types of addiction. And it's really based on the model that addiction is a treatable brain disease. I think people need to think about addictions as a brain disease that can be treated. The stigma needs to really be dealt with. But these people that have addictions, they're hurting and they're suffering, and is every part a brain disease, as is Alzheimer's, as is people with migraines. And that's really important. So I'm very excited about what's emerging now, new therapies that are being used to treat addictions, to reduce cravings. And that's an area we're very active. We're using the technology of ultrasound energy that goes into the brain, and we're able to reset the area of the brain involved in addiction to reduce the cravings, and then allow the patient to work better with the therapists to regain the control of their lives that has been taken away by the progression of addiction over decades. So I'm quite excited about the treatment addiction opportunity. America needs to look at addiction as a treatable chronic disease, like we do for hypertension and like we do for patients with diabetes. That's really important.
And what about with behavioral health, with depression, with any of the behavioral health issues that we see? What's your sense of all that?
100%. Anxiety, depression, these are all brain physiology problems.
Bipolar or schizophrenia, do you think you can deal with that?
We need to learn more. We know the physiological underpinning of these conditions, and there are medications that can treat them, and now there's a whole range of therapies called neuromodulation. These are non-pharmacological approaches that use energy, electrical energy, like deep brain stimulation, ultrasound energy, magnetic energy, light energy, and sensory input, Governor. So it's a new age of therapeutics that is outside of pharmacology, called non-pharmacological therapeutics using neuromodulation. So that's really important. But the physiology is very important for these conditions. So anxiety, depression, it impacts so many people. Attention deficit hyperactivity disorders. People can be significantly impacted by these, and we need to understand the brain physiology of these and develop therapies, preventive therapies, lifestyle adjustments to reduce that, and also neuromodulation or these non-pharma therapies. Because, Governor, what happens, the brain always wants to shift and go towards balance. That is humanity, the human brain. But external factors keep on wanting pushing it, whether it's genetics or environmental factors or trauma and other things. So, but over time, the brain can shift from a normal balanced state of adaptation and resilience, which is an important concept for human brain, to becoming increasingly maladaptive and highly sensitive to external environment. And that's when a simple stressor can trigger somebody taking drugs or going into a major depression and all that. So we have to treat conditions by the underpinning of neuroscience, whether it's pharma, medications, neuromodulation, or basically faith-based approaches, and also lifestyle adjustments. Collectively together is what we need, not just one. The solution is all together, in my opinion.
What about autism?
Autism is another area that there's a lot of patients that have autism. We're able to diagnose it earlier and better. So I think a strong element is the detection of it earlier. And for autism, it has to do with brain synchronization problem in communication and being able to see cues like I'm looking at you, we're communicating, and body movements, eye movements, and all that. So autism is also a brain synchronization problem, if you will, and a brain coordination problem. So I believe there's a lot of hope for autism. So when you say keep faith, America, you're correct, Governor. There's a lot of opportunities when you bring in science together and discover, and that's what this country does. People in this country discover science and innovation, and that's what led this country with science and engineering and to lead it to be one of the best countries in the world. And basically, there's a lot of potential for the future, and we have to focus on science and innovation.
So you also treat a lot of people, is that right? I mean, you yourself or your close team
Yes.
are showing that these things, that we're making progress. Would you talk just a little bit about the progress that's being made, or some of the people who you've seen that others would say it's a miracle?
Governor, I think what we're seeing in the world of patients that have tremors, a condition called essential tremor, which is a benign condition, is a non-Parkinson's tremor, or with Parkinson's disease, or what we're seeing right now with addictions, new therapies are changing the way we're treating addictions and Parkinson's and tremors, and also even stroke, Governor. You can go with a device inside the brain and retrieve a clot that can before cause somebody to die from a stroke,
right,
or to become significantly impaired. But in my practice, what's very exciting to see patients that have severe tremors. Like a couple of weeks ago, we did a procedure in a 97-year-old lady who wanted to go back and interact more with her grandchildren and great-grandchildren. She was having severe shaking, and she got the ultrasound, an hour-and-a-half procedure, and she went home after that. So the key thing is bringing new technologies like ultrasound treatments, outpatient treatments. We have to become less and less invasive. I'm a neurosurgeon, but the goal is for me to be out of a job and not required to do brain surgery, but to make less invasive therapies. Just like for heart procedures, you can go through a catheter and they treat the heart with a stent in the heart and others. The same needs to happen for the brain. So technology needs to guide the future. And I think it has to start with the human suffering and the need. And when there's a need, you have to find a solution. And by partnering together, the government, public, private sector collaborations, and you are a champion of that in Ohio, the support that you provided allowed us to develop many new therapies. And that's the vision that we need to have in America, to accelerate discoveries and innovation to help people who are impacted by so many conditions, neurological and behavioral conditions.
All right, but Ali, is there a lot of sort of protecting one's turf or ego, or, I don't need to work with him because I know what, or her, I know. I get concerned that is something that is making it difficult for people to collaborate.
Governor, I think collaboration is critical. You have to forget about your ego, because you have to look at the patient. You're here for the patients and the families. Whenever it's about the ego and individual, I believe you're tempting faith and you're basically going to cause problems. It's really important to stay focused. For me, I always tell the team, whenever they are like getting off focus, I said, look at the patient, talk to the patient, and that is the answer is right there. So many times when you sit with a patient, like I saw my patients earlier, you have to sit down and listen to them. And when you listen to them, the solution is always there by just listening to them. And so from my point of view, nothing is achieved without collaboration. And if it's one person doing it, that's why I say it's not me, it's a team. And the better the team is, the better I am. And that's how I look at it. So teamwork and collaboration is what makes the world go around. Competition is what makes the world go around. It's good.
Well, listen, I appreciate you taking the time. I want you to get back to your work, and every once in a while we're going to check in. And you just lit the fire under me again about collaboration, and I've got to go back, see if we can get some better collaboration here in this whole region of where there's so many brilliant, smart people that can work on this, and where the patients can really benefit. So I will see what I can do.
Yes, Governor. You've done it, Governor, at Ohio and all through your career. So you brought teams together. I remember.
Yes.
Supported us. You allowed us to get one of the new technologies in Ohio that help patients. So really, you have to bring in technology and teams together and check your ego outside, move it outside, and focus on the patient. The rest falls into place.